Welcome to today's webinar in the Knowledge Mile series, part of the Lord Mayor's lectures on behalf of Alderman Professor Michael Mainelli, whose theme for his mayoral year is Connect to Prosper. In this free online lecture series, we address the connections in and around the square mile, what Michael likes to call the world's coffee house, and how these might help us to tackle future global challenges. I'm Professor Tim Connell, an Emeritus Professor at what is now City St George's, University of London. I'm also Chairman of the Gresham Society and a Fellow of Gresham College here in the City of London, and I'm also a liveryman of the Stationers' Company. So I'll be convening this session and moderating the questions and answers after today's lectures. So this is a plan for today: a very quick introduction for myself, then a discussion between myself and Lara Lewington, you can see there, and then we have about 20 minutes for questions. So today, a really good topic: can AI save us? How doctor data could be the future of health. So I'm delighted to welcome technical author and broadcaster Lara Lewington today. Firstly, Lara, can you tell us something about yourself?
Thanks so much, Tim, and hello everybody. Thank you for having me. For the past 15 years, I've been on Click, the BBC's technology programme. I am also the AI agony aunt for ITV's Lorraine. I make various radio documentaries and TV documentaries as well, all along the lines of AI and/or future health.
So can you tell us more about AI and how do you think it might save us, and how might doctor data be the future of health, hopefully for us all? So
Wow, it is such
how did you get into this particular topic?
Well, it's such a huge question. And how I got into it, well, I've been working on a technology show for 15 years. And I have been talking about artificial intelligence for a long time. And one of the things that I thought was really important was not just what AI can do, but what it should do. And I felt that this conversation was really being missed. It's not just about what technology is capable of, but in what ways it'll make our lives better and how we should actually be using it. And it was only when ChatGPT emerged that I think this very conversation went
Yeah.
mainstream. And then at that point, not only had the conversation gone mainstream, but it has started to go off at a tangent sometimes in a way that I think actually confused people more. There were a lot of newspaper articles that were talking about the fear that people have next to pictures of humanoid robots. And people were imagining that humanoid robots were going to take over, and that was the main danger. When actually, of course, there's real risk out there of cyber war, of disinformation, of bias, those things that are very, very real potential problems right now. But actually, people were worrying about something that was not really the right thing to be worrying about. So I became quite passionate about the conversation on AI being the right conversation. And this timing coincided with a show I'd had commissioned on longevity science, where the biotech companies and the real science was coming to fruition. And it was no longer just some weird stuff on the fringes. There was actually some real stuff there that could change the future of health. So I think the combination of people being interested in artificial intelligence and what science was making possible in terms of healthcare made me just feel it was so important to have this conversation about AI and health, where AI is going to be absolutely transformative.
Has it actually started, or it seems to me that we've been talking about it, as you say, for quite a long time, and used to been quite frightened of it, and all of a sudden we're beginning to see examples of it around our everyday lives. So has there been a rapid technological advance just recently, or are we just more aware of it?
Well, I think there's kind of two sides to this question, actually, because first of all, AI has been all around us for a long time. Your smart assistant in the home, your smartphones, so many devices, so many platforms we're using online, everywhere. AI is not new. But since the large language models emerged, new types of AI have come to the forefront. And I think the fact that people have been able to have their own interactions with it by just simply using ChatGPT or the like, people are suddenly feeling more aware of what AI is doing. So rather than just, oh, it works, thinking about how it works, what's it doing? This is AI, what is AI, what isn't? And we're getting to a point where the difference between knowing whether you're talking to a human or not, and it's all very controversial as to whether people think we've passed the Turing test or not, whether you're talking to an AI or not has actually become far more questionable. So that has really stirred something emotional up in people, the fact that they feel it could be a human. But alongside this, in healthcare, AI has been being used for a long time, but we're just reaching the point where it is becoming far more useful. There are a huge number of trials that take place in the NHS. International tech companies want their stuff in the NHS because of the data there's access to. It is still very siloed. There are whole technicalities going on that side, which I shan't go into at this moment. But we have a healthcare system where these things can be used with a relatively diverse population compared to somewhere like Taiwan that's been using AI in healthcare for years, but it's a more homogenous population there.
Right. Something interesting there I shall hold up to see if people can see it. I found a 9-page article just recently from the NHS with a whole range of very useful links and connections about everything that is being done, can be done, and hopefully will be done. I was particularly interested in this idea that our iWatches could be used as a source of maintaining our health. How would that actually work, Lara?
Yeah, so our wearables are collecting constant data on us, and you can't underestimate the importance of that data. So we know that we want to see our heart rate variability, our number of steps, our calories burnt, maybe, although even counting calories can be controversial. There's a caveat to everything. But what we're also starting to recognize is experts are seeing patterns. For example, I spoke to Matthew Walker, a professor of sleep in Berkeley, and he was looking at the idea that just through the change in our sleep patterns, dementia could potentially be identified 20 to 30 years before symptoms emerge. And the idea of being able to identify conditions that early means we're in a position to give people preventative treatment or drugs that only work at the early onset of disease. So we can use that data for things that are so much more useful than we may have ever imagined. But we're only just starting out on this journey. And you combine this with something like full genome sequencing. It cost $3 billion to sequence the first person's genome back in 2004. Now you can do it yourself with an online kit for a couple of £100. Now, it is questionable how useful all that data is and how actionable it is right now because we're still learning about the human genome. There's a lot that we don't know. But as all of this data comes together, we are heading towards an era of healthcare where, thanks to AI, we can put together all of this data and see the patterns and understand from it things that were never possible before because no human would ever be able to do those calculations.
Right. I love the idea of a professor of sleep because I thought the definition of a professor was a person who talked in other people's sleep, but there we are. Now,
He's
you
actually
mentioned,
a professor of neuroscience, but he
oh,
specialises in
that's,
sleep.
I'm sure
Although
it's a
there
very,
are
very
professors
serious,
of circadian rhythm, it exists.
I'm sure it's a very serious topic. Now, you mentioned California. I think you did a program fairly recently about people trying to extend their longevity sort of almost permanently. Can you tell us a bit more about how long people might expect to live in California, if not anywhere else?
Yes, I think there's been a lot of talk over the years of what we can do to increase our lifespan. And it's been widely recognised now that that is the wrong question. Health span is the thing we should be looking at. In England right now, data from the King's Fund suggests that women are spending 25% of their lives in poor health. For men, that's 20%. So actually, rather than looking at extending lifespan and spending more years feeling like you're 80, the idea is to increase health span and feel like you're 40 at 60. So this has been the target for a lot of tech companies and a lot of experts and where we're headed. Now, I visited one of the blue zones in California,
Oh,
which
yes, yes.
and the idea of these places around the world is the people there are living life expectancies and health expectancies longer than other similar places. So in Loma Linda in California, where I visited, they're getting around 5 to 9 years of extra healthy life. And that's compared to other people in California and more widely across the US. Now, this is a group of Seventh day Adventists. And for them, the idea of looking after their bodies and being either vegan or vegetarian, not drinking alcohol, doing exercise, they see it as a duty of religiosity. So their reasoning for it may not be the same as many other people's, but the data has been showing this has been working well for them. Now what I do need to add here is I went to an assisted living facility, and in the lift there was still a sign that said no more than 3 walking frames at a time. And so this isn't magic. And I think that's crucial here, is that we shouldn't be looking at this as magic. If we can just help ourselves create an extra few years of healthy life, then that would be absolutely pivotal. And from what I've described to you already about tracking our health and genome sequencing and further understanding in personalizing treatments, that is even understanding the effect that a drug would have on an individual down to their genetics, then we're going to start to head towards a period of being able to predict illness earlier and therefore test earlier and treat earlier. there will be anomalies. This isn't going to be for everyone, and very sadly, it's going to be too late for many. But we are heading on this journey where that is becoming a reality, and that is absolutely game changing.
So it's not so much a question of staying alive for as long as possible, but using AI in order to keep ourselves, in my notes I said to keep ourselves young, but actually it's to keep ourselves fit regardless of age, isn't it?
Yeah, it's to try and keep ourselves healthy. And excuse me, and I think this is really the pivotal thing here, to focus on living longer in good health. And a lot of the things that experts suggest we should be doing go back to really basic traditional lifestyle things: sleep well, exercise well, sleep well. Sorry, sleep well, exercise well, eat well. And you think, well, surely they're obvious and we know that. But there is actually really detailed research going into it now. So, for example, what constitutes exercise, and how much of it you need to do to make a difference, and how it varies from person to person, and how different it is throughout different parts of our lives. And it appears to be the case that doing no exercise at all is really bad. Doing loads of exercise is, without it being excessive, is often better than doing a small amount, but the difference between doing a small amount and none is absolutely massive. And we all want to live happy and fulfilling lives, and we don't want to be focusing on this in an all-out way that we're distracted from all else. But there are small changes that people can make, and you've got the science going on there in actually personalizing those ideas and really quantifying what needs to be done. And then you've also got, for example, biotech companies who are looking at the mechanism of aging and diseases of aging, as they're known, which is the diseases that have a higher risk as we age. So cancer, heart disease, type 2 diabetes, kidney disease, and so on. If aging is the main risk factor, well, if we can push back the cellular aging of our bodies, we start to push back the disease as well. So between the understanding of risk, the prediction, the prevention, and hopefully the ability to push back a bit through lifestyle, we are starting to head towards achieving what people in places like Loma Linda are.
Well, I must admit, when people say that, 60 is the new 40, I think back to my grandparents. And of course, you think about levels of nutrition, levels of general health and hygiene, two world wars, the 1930s. It's not surprised that they were completely worn out by the time they were 70. And I suppose there are factors surrounding us. I suppose there are newer ones like pollution. You wonder about the effect of, traffic pollution and smog, whatever, on people as they get older, the state of their lungs. But I think what concerns us more today is the state of the brain, because you can take lots of exercise, you can exercise your muscles and your joints, which I'm quite conscious of at the moment. But how do you actually keep your brain going? How do you keep your brain sort of fit? Um,
Well,
what can we do to actually help? Yes.
this was something else I investigated. I did one show on the body, one on the brain, and I went to Stanford, University of Berkeley, University of Southern California. I'm not a scientist or a doctor, but I have gone and met with the leaders around the world that are working in this. And I asked them initially the question of separating this into two things. First of all, the natural brain aging that we're all going to go through, and the actual disease process of something like dementia. Because I think there is an important separation here. Although what's leading up to it in terms of the importance of lifestyle, they kept on reinforcing was the same for both. And it's interesting to talk to these leading scientists and the tech companies, the biotech companies creating these drugs that are trying to target aging, albeit they can't get approved for aging at the moment. So they focus on individual disease with a long-term plan that hopefully they'll have broader use. And the way that all of these people go back to the idea of how we live our lives is really interesting. And I don't think it is a cop out. I think it is actually a very realistic understanding of where we are, because now we are able to assess way more within the brain through fMRI scans than we ever have been able to before. And AI is being used to do that. So somebody who I spoke to when I was at University of Southern California, Andre Miria, a professor there who is doing some absolutely brilliant work. He's actually just come over to the UK recently as well. He is looking at scans of the brain to see how the brain ages. And this idea is being commercialized by somebody who was one of his students as well, into a company where anybody can do this. You've just got to get hold of an fMRI scan. And what it looks at is not just the overall aging of the brain, but how each section is aging. And it can identify those patterns that could be heading towards dementia. So, of course, we have other ways of diagnosing dementia, and we're seeing an increase in what blood tests can do, and obviously there are the scans, there are lots of other things going on, but in terms of looking at patterns and what we're heading towards, that has become critical in prediction. So the idea with this is that you would scan somebody's brain, understand what's going on, and then through giving them medication or lifestyle interventions, you could go back and actually see what progress was happening. And it gives scientists a way of being able to identify far better what's working, how disease process could even be stopped in its tracks or at least slowed down, and understanding that and seeing it rather than speaking to someone and seeing how they are, really being able to quantify it has become very important. Now, the company that has commercialized this, where it's an app and a platform that anyone can access, and there's a few clinics in the UK and certainly around the world where you have access to doing this, also give you a 3D printed
Oh,
version of your brain, which I thought
now,
was
whose brain might
fascinating.
that be?
This is my brain. And all jokes aside, I was surprised by how large it was,
Oh,
because
yes.
that only just fits in my head. It shows how little there is between that and your skull.
Yeah.
Um, Interesting to see. And I think with all of this kind of longevity stuff, the more you understand about your body and see it, the more you can become interested and motivated, maybe. Because I've also gone to other companies where they fully scan your whole body and they're showing you your kidneys and your lungs through scans. It's quite weird to look at it all. Nothing looks like it does in a textbook. This has pride of place now.
Oh, that's absolutely splendid. That's one of the best paperweights I've ever seen. Now, um, eh, well, the brain in itself is quite remarkable. Um, I'm not only astonished by what brain surgeons can do, but by colleagues, particularly at Gresham, who actually seem to understand a lot of as to how the brain works. And I think a lot of research is being done on that, which in the long term must be good for us all. But of course, it's also a matter of keeping the brain fresh. Now, as the linguist of the family, I'm pleased to say I saw a report which said that learning languages kept you young. So the more you learn, the longer you're going to last. And I've learnt
Yeah, you're
about
doing
five,
well,
and
Tim.
I speak about seven badly. So I think I'm going to live to be 190. There we are. But presumably, it is important to have interests and to sort of keep
Well,
the
it
brain
is.
alert. Is that yes?
Yeah, absolutely. And this was something else that we looked at in Loma Linda, and I talked to the scientists about. This idea of keeping the brain alert is really important. Languages are good. There have also been studies into people who've learnt musical instruments. University of Edinburgh did a study into those who had learnt musical instruments back in the 1960s and how they are doing now. And it showed indications that people were having less cognitive decline. Now, obviously, there are a lot of other factors that we need to look at here, the importance of socioeconomic group in a lot of this. And I mean, actually, this is your postcode is still one of the biggest measures of life and health expectancy. And I mean, I could talk forever about how that is trying to be dealt with to create a more uniform benefit. But I'll just answer this question first. But in terms of the impact of music, the impact of keeping the brain stimulated, well, that's really important. And at Loma Linda, we went to a session where people were playing the piano and singing. But the thing that was also going on there was the sense of community. So they were getting together to do this music, but they were also within a community where it was the norm to gather together. And that sense of not being lonely, a sense of purpose and feeling fulfilled within your social life. One doctor described it to me as social nutrition, he calls it, the importance of actually having that. And I think all of us have probably seen that in some cases anecdotally, but to see that it's real and that the science really indicates the importance of those interactions. And in fact, a lady that I met at Loma Linda who ended up being quite the star of the TV show was 103 years old, and she was called Mildred, and absolutely lovely lady, welcomed us into her home. And she had been a doctor. She'd set up a hospital in Uganda in her youth. She'd had an incredibly fulfilling and giving life. And she'd moved to Loma Linda to work in the healthcare facilities there. I've never seen so many hospitals close together, which I thought was slightly ironic for one of the healthiest places on earth. Maybe it's why they're one of the healthiest. Anyway, and Mildred is 103 and has simply had enough. She lost her daughter 30 years ago. Her son is really ill. She doesn't have any disease. She doesn't have dementia. She doesn't have any physical disease that you could actually explain on paper. But every time she stands up, she's got a walking frame now. And every time she stands up, she's scared of falling over. And she just feels like she's not really benefiting much now, and she doesn't feel that this is any age to be. And I tried to explain to her, the tech entrepreneur spending millions trying to reverse his biological age, who I'd gone to interview, who wanted to live forever, because I just wanted to see her reaction to it, and she was not impressed.
Yes, well, of course, I think dying of despair is something which tragically is seen. It's not entirely unknown for widows to pass away quite soon after their husbands. My own grandparents, for example, died within 4 weeks of each other. So I think
Wow,
this
yeah.
idea of isolation, which brings me on, I think, to the question of should we be afraid of AI? Because doing everything on the screen is all very well, but there is some concern about the psychological impact of people working from home, the fact that children were excluded from school for quite so long because of COVID. Could we become too reliant on technology to the extent that it could actually be harming our psychological well-being?
Well, I think there's a lot to unpack there because there are a lot of different elements to it. One of the ideas being the potential social isolation. And look, it depends who you speak to, what answer you're going to get here. I realise you're speaking to me right now. But, but in terms of the isolation, well, there are also ways in which technology helps us interact with people. Look at Zoom and video calls, and even the fact we can do this lecture right now. The fact that things become possible that wouldn't
Mm.
have been possible without the technology, allowing for more interaction, more way to learn, more ways of feeling like you have spoken to people when you're otherwise sitting alone. Working from home is a sort of separate entity, maybe, to this, and I know people have mixed feelings about it. But I think, should we be scared of AI is obviously a huge question that is asked time and time again. And the fact that some of those who are leading the way in AI are the main voices of telling us, yes, we should be scared, is possibly not helpful. But I think it's actually too broad a question, because AI is going to do incredible things for democratizing education, for healthcare. The benefits are things we have never seen before in human history, and life is going to be absolutely transformed. We have this habit of overestimating right now and underestimating the future. And I think that may have been the case. There was massive hype over everything that happened last year. And now people are feeling, well, yes, we have ChatGPT, but actually life's still quite normal right now, 18 months later. But we are heading towards something very different. And we are also all seeing smartphones as an extension of ourselves, no matter how much we're in denial. Even my parents, who will be listening now, even they have their smartphones with them all the time. It's something that has become part of all of us. And if you ask somebody like Elon Musk, Ray Kurzweil, the people who are the most ambitious and futuristic of the futurists, they will say to you, well, the man and machine will become one. Brain computer interfaces are going to be put into all of our brains. So we don't need to worry about AI taking over, because it'll supercharge us. And the combination of humanity and AI will create the best we could ever want. That concept would seem absurd to most people. But one thing that we know we can't get right is predicting the future. None of us can say
Ah,
exactly how things are going to look in 100 years.
that was going to be my last question. Is AI infinite? I mean, where would we like to be in 5 or 10 years? I mean, within a recognizable horizon, where do you think we might be?
Well, it's not just that AI is going to be able to do a lot for us in terms of the possibilities of understanding for health, for education, in the workplace. It's going to massively be able to increase productivity. And I'm sure any questions after this are going to come about access to all, and also what it means for jobs, because they are the classic questions that we go back to. But I just think that where we are heading to with AI is such a broad impact on our lives overall, that things are going to change beyond what we could ever have expected, but not necessarily in ways that we could predict right now.
Ah, right. Well, we're getting questions flooding in, some really good ones coming up. Some positive, some negative, I have to say. Let's start off with a nice technical question from Graham Elliott, totally unfair. Will AI consume too much energy to be a sustainable way forward? Will we have enough electricity to run it?
Well, this is something that has been raised a lot, and I actually made a BBC Panorama programme on the very topic. And I think what people worry about is AI requires a lot of data. Data requires a lot of power. Data centers use huge amounts of power. So, what does this mean for the amount of power we're going to be using? Now, there's somebody called Kate Crawford, a professor, who often talks about the risks of this. But when you speak to the big tech companies, I went to speak to Microsoft. I went to speak to Brad Smith, the president of Microsoft, on this, and he was talking about their engagement with renewable energy and how they were going to be creating communities around the renewable energy that would be used for these data centers that they were actually hoping would have a positive impact. The other thing that you need to factor in here, and this is something I've spoken to Professor Stuart Russell about a few times actually, is that the benefits of AI in terms of climate change and making things more efficient and being able to understand efficiency and the way we use power better than ever before is huge. So actually, how you might balance out what's happening in data centers versus that is quite difficult for a start, but he believes it's just not a problem and it's being overplayed. There is, of course, the point of where data centers are. When I spoke to Microsoft, when I spoke to Google, the places that they are aiming to put them are where they can use this renewable energy. But then when you've got data centers in, say, parts of India, you're more likely to be using fossil fuels, and that's where you are seeing greater damage to the environment. And so I think it is a balance overall. But how this plays out precisely in the exact numbers, I don't think anybody knows now, but it is argued by a lot of experts that it's actually benefits over damage.
Right. We do obviously have to raise the NHS in this context, and Chris David is quite worried. He thinks that the NHS is broken, unable to cope with a poor record of tech uptake and investment, particularly with regard to things like wearables. How do you see the tech industry and society working around this barrier?
Well, this is a conversation that I have had time and time again, both about access to all and how you bring it into healthcare systems. I've done a lot of work in the UK and the US, two vastly different systems. And within the NHS, first of all, a lot of trials are happening because we have the data sets, we have, as I discussed earlier, relative diversity. But what happens after these trials? Because we're seeing a lot of successful trials that then aren't enforced. Now, one of the issues here is, and Professor Andrew Scott's work is really interesting on this, he estimates that if we could just get people in the UK to have an extra healthy year of life, that's 1 year of extra healthy life, the UK economy could benefit by 4 trillion. Now, this isn't just in prevention of treatment, but it's also keeping experienced people in the workplace longer. It's not having people off work. It's about the entire functioning of an economy.
Mm.
And well, I think one of the things that is one of the big challenges here is this is where prevention becomes important. And obviously, we are actually seeing some steps towards this in the NHS right now. But where this prevention becomes important, there's no argument that prevention not only saves human suffering, but also will save a lot of money. But the issue is often they're different pots of money. Where money is saved is not in prevention, is not the same pot where it's being saved in treatment, even within the NHS. So when you then move this into something like the US system, where you've got people changing health insurer on average every 7 years, well, the chances are a healthcare provider, an insurance company is going to do all of the preventative stuff for somebody and then not benefit when they don't get sick further down the line. And when you've got a healthcare system like that in the US, which is very much based around business, that's where it becomes even harder to enforce than it is here.
Well, interesting. The NHS report I mentioned at the beginning actually has a list of potential benefits of AI in general practice, where the report seems to think that this is where it's really going to have an impact. Automation and service efficiency, diagnostic and decision support, precision medicine, so using multiple data sources to calculate patient risk, image analysis, whereby you actually get your results back far faster than I have recently, continuous monitoring, so where you know that someone has a condition as opposed to an illness or a disease, actually seeing whether it's getting better or worse. The consumer technology having a role whereby smartphones and wearable devices will enable monitoring and therefore keeping people healthier for longer. And also, rather interestingly, the question of public health by looking for patterns of illness in a particular part of society, particular part of the country for that matter. So there seem to be lots of elements here. Now, James
Yeah, there's
Flecker's raised an interesting question.
absolutely
Yes.
loads of stuff. There's so much going on already, and I actually don't, because I've covered so much of this stuff and I see it, but I'm not sure that a lot of this stuff going on gets that much coverage. So
Yes.
there is a lot happening, albeit a lot of it in small pockets.
Yes, before I forget, I also noticed that in 2019, Eric Topol produced a review So try looking up the Topol review on AI in the National Health Service. He also wrote a book in 2019, again called The Digital Future. So that might be something to that's worth looking for in order to look forward to see what forward projections are. Now, James Fleck comes up with a point here. Is it just a matter of AI only, or more generally computer technology and the effective harnessing of vast amounts of data that we actually have to cope with?
It's about AI augmenting humans, and it's about AI doing the jobs that AI can do better than humans and leaving humans to do the human bit. I recently went to Columbia University in New York to film an IVF robot. And I was talking to it was an amazing fertility R&D center that I was at, doing some absolutely incredible work. Main premise is this is to help people who otherwise couldn't have children have a family. I mean, it was really simple. There was a robot that was finding sperm through AI in a way that no human could have seen it under the microscope. And then you had an IVF robot, which, I mean, I think that creates all sorts of visions of what takes place. But what it's actually doing, it's doing a sort of pipetting job, most of it. And what the scientist said there to me was, I think, really the pivotal point here is you see which bits AI can do better than a human, and also can keep doing them every time well enough, better than a human consistently. So not only do they do it better, but they don't get tired like a human. And what they were doing in this lab, and they really spelt it out to me in a way that I sort of hadn't really heard said this clearly before, that we're finding which bits the AI can do better. So the AI does that. We've actually found some other bits are better still done by the human. So the human does that. And sometimes you may have a company that has its whole pitch based around the idea of it's fully automated. Well, yeah, that might be great for their efficiency. But actually, when you talk to someone like Zev, who I spoke to at Columbia, and you see where there is real data on which bits should be done by a human and which shouldn't, they come together. And when it's radiology is obviously an area that AI is being used a lot to look at scans. And you do hear all of these headlines about how the AI can see something better than a human. Well, and the AI is very, very good at seeing the thing that it is looking for, the thing it has been trained to look for. And in many cases, it can do that better than the human. But the AI doesn't know if the scan's been put in upside down. The AI doesn't know the obvious thing that any specialist might see if it hasn't been trained to, and also if the regulation hasn't signed it off to do so. So AI can do a remarkable job. It can massively increase efficiency, which is obviously a benefit we massively need in the NHS and generally. But there are elements that still require a human, especially the interaction, especially those bits where it's the doctor's bedside manner that matters. You don't want an AI chatbot talking to you. And also there is this question over liability. And right now, because the AI isn't compulsory to be used, that liability isn't sitting with the AI company. The doctor is still liable. So the doctor's role is still crucial. Now, obviously, this is something that may evolve over time as we see AI's role evolve, but that's where we're at right now.
Oh, right. Yes. Automation bias is one of the things that NHS report picked up on. Because it's a machine, because it's a computer, because it's AI, you tend to believe it. The post office scandal is quite a good example of that, isn't it? Paul Moxie also it gives us another piece of information. Someone called Yuval Harari has just published a book called Nexus, which highlights numerous concerns about AI, including AI making erroneous decisions, decisions as a result of things not foreseen by humans, who actually set the processes up in the first place. Are we right in trusting AI to the extent that I think we're going to?
Well, this is actually the next book on my reading list, funnily enough. Um, I think the question over what we allow AI to decide and how those decisions are made is really important. There's the black box problem. We often don't understand why AI has reached the conclusion it has. We know the input, we know the output, what happens in between. Especially in healthcare, a doctor needs to sit there and understand how a decision has been reached. So I think that's one thing. Also, there's a question over, even if AI made fewer mistakes than a person, how do we feel about being victim of those mistakes? So if you put this into the context of a self-driving car, let's assume that we are at a point where fewer accidents happen than they do with a human. Well, if a human being has caused an accident that with tragic consequences, the family of that person has a feeling of what the driver has to live with for the rest of their life. I mean, let's just put this into the context of real human feeling. You don't put those same emotions onto a machine. So how we feel about a machine doing something is very important here. And a lot of these questions over how often AI gets things wrong, are we questioning how many times it gets it right or wrong? Or are we questioning the nature of how it's right or wrong? Is it because we don't understand how it reached that conclusion? Or is our problem that it's a strange mistake that no human would have made? And because we look at what error has happened as being something a human wouldn't have done, well, AI is doing a terrible job. There's going to be huge benefit. We're also going to be, as time goes on, giving more and more power to it and trusting it more and more. And we do need to be sure that we can trust it. And we do need to have that transparency of understanding why it thinks what it thinks.
Yes, Graham Elliott actually raises a similar point with regard to the Turing test. Can you tell us a bit more about the Turing test?
Yeah, so the Turing test is the point at which you can speak to a machine and believe you are interacting with a human. Now, I actually carried out an interesting experiment on this where Sam Altman had posted at the sort of early days of ChatGPT. It's something like we'd reached AGI. I mean, I can't remember what the words were. I can't remember if you referred to the Turing test or AGI, but it was one or the other. And, sort of everyone carried on with their day. And then, so I thought it was interesting that he wanted to suggest that ChatGPT, you could believe you were talking to a human, and so we'd pass the Turing test. Now, I don't think it's certainly not widely thought that that's the case, even though one bit of research that some people did sort of said, yeah, you did believe you were speaking to a human. But then I asked ChatGPT, is AGI here now? And ChatGPT, despite being the creation of Sam Altman, said no. So they didn't agree. I mean, also you can ask ChatGPT or other similar platforms the same question a few times and get completely different responses, which is another story of hallucination and just variety and data selection. Have we reached AGI? No, I certainly don't think we've reached AGI at all. That being the passing of the Turing test. I also think that there is a question over: are we asking, do you believe that you're talking to a human being in general or a specific human being? So if I was to make a digital twin of myself and I was to send it to a work meeting or have a Zoom with my friends, I don't think for a moment they would believe the fake version was me. Whereas could you believe a human being had been created? Well, maybe. I think that, we're getting there and we're not far off that. But AGI, will we ever get there?
Yes, Mark Cook touches on this as well. He thinks we should be very careful with language, wondering whether we're just talking really about a huge machine learning model, and he doesn't think we're anywhere near what is, strictly speaking, artificial intelligence. Would that be
Well,
right?
I think what he's referring to is artificial general intelligence, and I think he's absolutely right.
All right. Well, I'm afraid we do have a lot of questions, but I do have to report that Lara has persuaded the builders next door to stop working for 40 minutes in order not to have her very, very interesting lecture disturbed by um, other sorts of machinery. But there we are. First of all, could I say that we have covered AI quite a lot in the course of the Lord Mayor's lectures. There was the lecture on ethical AI, which took place on September the 10th with Matthew Mays, the one on using AI in museums with children by John Meggitt on the 5th of September. And of course, the Lord Mayor himself has been very heavily involved with ethical AI with his initiative, which has been running this year with regard to an examination and testing linking to the financial services sector. If you look at the bottom here, you can see the the URL, so you can follow through to that if you would like. Now we're coming to the end of the Lord Mayor's lectures. We only have one more tomorrow. We've managed to clock up 108 in the course of the Lord Mayor's year. You might be interested to know the FS Club, Financial Services Club in the City of London, does run regular webinars, but particularly on business-related topics. But again, very much the same sort of format, which you might find of interest. And if you're interested in brains in particular, we did have The Lonely Brain with Brian Lawler, which went out on the 19th of September. So I would firstly like to thank Lara very much indeed for most informative, very lively, and very forward-looking sort of session. So
Oh,
do look
pleasure.
out
Thanks
for
for having me, Tim.
Well, look out for Lara's contributions on the rain in the mornings and on the whatever the next program is with Panorama. May I, of course, thank the audience. I'd especially like to mention the regulars, one of whom clocked in 40 minutes early this morning just to make sure that he was connected properly. We've been very impressed by the number of people who've been following our lectures right the way through the year. And of course, I do have to say thank you very much indeed to Lara Lewington for a very, very interesting presentation today. Lots of information for you to take away and hopefully, I think, a positive view of the things that AI can do with our health. And I wish everybody the good fortune to live to be 100. Thank you very much indeed, and goodbye.
Bye bye.